Okay, so last class we have seen about the anatomical aspects of women. So today we will see about the antenatal period. So as a PT, we have a great role during the antenatal time because we know that pregnancy is a normal physiology, and there will be a lot of physiological changes that will be taking place during the pregnancy, and the women need to adjust to all these physiological changes. So when they are going to adjust to the physiological changes, definitely they will be having some discomforts, and definitely they will be having some issues. So as a physio, we will be able to prevent those problems, as well as we will be able to help them to overcome the discomforts. So I don't say that we cannot, we can stop the discomforts. So definitely we cannot stop the discomforts, but we will be able to help them to overcome the discomforts. Is that clear? So I hope Dr. Deepthi would have taken all the antenatal theory part. So today we are just going to see the practical aspect. So we will see the assessment of a pregnant woman, then we will go into the antenatal exercises. So as a guideline, so these guidelines I saw in her slides, she has already gone through these guidelines. So we need to avoid bouncing movements, ballistic movement and jerky movement, because these movements will lead to, this movements will injure the musculoskeletal system. So that's why we need to avoid this jerky, bouncy and ballistic movements. So the exercise should be from mild to moderate. So mild to moderate means it, in Bogue scale it should be nearly 12 to 14. That means somewhat hard. So the women, when she is doing, she might feel little bit hard, but not too high. So that is your mild to moderate. And you need to have a warm up session and a cool down session. And you have to include flexibility exercise and mobility exercise, because they will have a lot of tightness, muscle tightness. So one group of the muscle will undergo tightness and the other group will be undergoing weakness. So we need to give good flexibility exercise to stretch the tighten muscle. Then we need to give mobility exercise so that they will be able to do the movements or do their day-to-day activities normally. Then avoid any strenuous exercise, especially in hot and humid climate. We have to avoid the exercise because that will increase the core temperature. So when the core temperature increases, definitely it will be affecting the baby. It may lead to miscarriage. So that's why we need to avoid doing exercise in hot and humid climate. Then the maternal heart rate should not go beyond 140 beats per minute, because already the mother will have little higher heart rate. The heart rate will be little higher than the normal. So if it is going so much higher, then it may affect the baby. So then the exercises should not be longer than 15 minutes. That is continuously, the women should not do exercises more than 15 minutes. Then the fluid intake should be normal. They have to drink proper water to avoid dehydration. Then if the mother is a sedentary lifestyle means those who are doing sitting job or those who are doing a very simple job. So for those people, you need to start the exercises with very low intensity, because they may not be exposed to any exercises and other things. So suddenly if you are giving more exercises, they may not be able to tolerate. The body may not be able to accommodate to that. So that's why you need to go for a low intensity exercise for people who are having a sedentary lifestyle. Then you have to include aerobic component, and most of the aerobic component you can go for brisk walking, cycling and aerobic dancing. Aerobic dancing, you should not give dancing for people who are new to dance. Don't go and teach them dancing. Already if they are a dancer, already they know dancing, then they can go for this aerobic dance. Otherwise don't include this dancing as a new exercise or new thing to them. Then avoid supine lying position after first trimester because this may compress the inferior vena cava and this may reduce the venous return and this may cause a lot of other issues. So that's why we need to avoid supine lying after first trimester. Then they should not stand for a very long time and they should not have any competitive elements. So they should not feel the other person as a competitor and they should not do any exercises. So these are the then other thing is no stressful exercises in the first trimester because first trimester we need to be very careful, especially till 12 to 15 weeks. The placenta needs some time to get settled, so it has to get embedded in the uterus. So if it is not embedding properly, then it may lead to miscarriage. So you need to be very careful during the first trimester, especially till 15 weeks. You need to be very careful. Then you can you can ask them to use the Swiss ball because the Swiss ball will give you good exercise. So the thing is, in the Swiss ball, even if the mother is simply sitting also, it will be inducing the co-contraction in the core muscles. So this will lead to strengthening the spine extensors as well as the flexors. So you can introduce Swiss ball if they are affordable as well as if they like the ball. Then like you avoid overstretching and passive stretching because already the joints will be very loose and already the muscles will be very there will be more laxity and the muscles also will be loose because of the hormonal influence. So you need to avoid overstretching or passive stretching. Then avoid single leg weight bearing. So many of the women will have this habit. Whenever they are standing, they will go for single leg weight bearing. So you need to avoid this because the SI joints and the symphysis pubis joint will be loose. And if they are going for single leg weight bearing, this may lead to some issues in the joints. Okay, then uh, you have to ask them to sit and stand slowly. That is all the movements from lying down to sitting, sitting to standing, then standing to again sitting, lying. All these movements should be very slow and it should be smooth. They should not do it very fastly. Avoid Valsova maneuver because whenever they do Valsova maneuver, they will be compressing the inferior vena cava. So this will lead to reduced venous return and this may lead to reduced circulation. Then the core temperature should not go below 30, should be below 38 degrees Celsius. If the core temperature increases more than this may lead to miscarriage. So you need to be very careful. That's why you avoid doing exercises in hot and humid temperature. Then do not do developmental stretching or do cross training. Cross training means like you will be doing upper limb exercises, then you can go for lower limb exercises, then again come to upper limb exercises like that. So don't continuously do one particular segment. If you are doing continuously for one particular segment, the mother might feel tired. So that's why you go for cross training. Encourage them to complete the bladder before the exercise because they will not be able to hold the bladder for a long time. So you need to encourage them to empty the bladder before the exercise. Then you do hamstring and adductor stretching because these are the muscle that will be leading to tightness and sometimes if you do too much stretching, this may lead to hypermobility of the pelvis. So you have to be very cautious when you are giving this hamstring and adductor stretching. You need to do, but don't do over stretching because this may lead to instability in the pelvis. Then exercise at least 3 times in a week. Then you need to encourage them to use Boke scale rating 12 to 14. That is your mild to moderate. So in short, if you see the Boke scale, they should be able to talk in between. That means when they are doing exercise, they should be able to talk. So that particular if they're able to talk, then that indicates that you are doing the exercise between 12 to 14. Is that clear? So during exercise, if you are just asking them any question, they should be able to answer. So these are the guidelines and these are the contraindication. Contraindication, absolute contraindication means definitely you should not do exercises. So we will go into the practical aspects. So this, I think this also she would have taken, what are the benefits of exercises. So we will start with assessment. So first is your subjective assessment. Subjective assessment means um, the normal details of the mother which you need to know before going into the exercises. So the subjective part. So name, age, weight, height. So weight and height you need to know to calculate the BMI. Then marital status, occupation, hobbies. Occupation and hobbies you need to know so that you can modify the ergonomics according to their occupation and hobbies. Is that clear? Consultant name and chief complaint means during that time if the mother has any discomforts or any other complaint. But usually like this antenatal exercises will be given like antenatal classes or individually the couples may come to you for some issues. Okay, so either you will be conducting antenatal classes or the couples may come to you with some problem. So whenever they are coming to you with some problem, then you have to go with the chief complaint. If not, then directly you can just ask them whether they have any any complaints. If not, you can just go with the group exercises. Then so mainly here in women's health assessment itself, you will have lot of history taking, because we will not be able to do the assessment fully. So when we are doing the assessment physically, we may not be able to do lot of assessment. So what we do was we do the history taking in detail. Okay, so that is very, very important. So not only in antenatal, even in postnatal and gynecology, everything, history taking is very important. Is that clear? Okay, so in history taking, the first is present history. So present history means what is the onset of the problem if they have, for example, if they have low back pain or if they have thoracic pain, like that. So in that case, what is the onset of the problem? So the problem may be like sudden onset or gradual onset. So you ask about the onset of the problem. So they may have many problem also. Then personal history. So personal history like regarding their smoking and drinking habits, regarding their hobbies. Why we want to know about smoking and drinking habits means you need to advise them to stop smoking and drinking. Then why you want to know about hobbies means you need to teach the relaxation exercises along with the hobbies. So that's why you need to ask their hobbies. Then regarding their diet, normally during pregnancy, the mothers will have constipation. So that's why you need to ask about their diet habits. Then regarding their anorectal function, that is the frequency of voiding, maturation, then whether they have constipation, whether they are having stainful defecation, all those things. So this is in the personal history. Then in the medical history, you want to know whether they are uh, having any medical problem and what are the treatment they are using or what are the medicines they are taking for it. So any medical problem they have and what medication they are having for that particular medical problem. Then the next is regarding the obstructive history. Obstructive history means their gynecological history. So, sorry, obstructive history means their number of deliveries, number of child they have, all those things. Okay, so this is done by GPAL. G means gravida. Okay, please note down. G means gravida. Gravida means number of pregnancy, or you can say number of conception. Okay, so G is number of conception. P is parity, number of delivery. Okay, that means number of child they have delivered. A is abortion and L is number of live children. So G is number of conception. So number of conception will definitely be more for some people if they have miscarriage and abortion and other thing. So parity means number of deliveries they had. Then A is abortion, number of abortion, and L is number of live children. So then if they have any P, then you have to ask what type of delivery they had, whether they had any cesarean section or they had normal delivery. Okay, so you need to ask if they have P. If they have only G, that means like normally it will be written as G2, P1, A1, L1 like that. So that means G2 means two conception, P1 means one delivery, A1 means one abortion, L1 is then live birth. So okay, so it will be written like this. So in this case, then you have to ask what is the type of delivery they had, because they had one delivery. So you need to ask them what is the type of delivery they had. Okay, so next is regarding the gynecological history. So gynecological history regarding the menstrual cycle, whether they have regular menstrual cycle or irregular. So whether they have any hormonal imbalance, all those things. So that is your gynecological history. Surgical history, so far they have undergone any surgery. So if any surgery they have undergone, what is the surgery they have undergone and for what reason. Then previous management, previous management, like whether they have taken any medical drugs, surgical, physiotherapy, or any treatment they have taken related to pregnancy. Okay, not all the other things. So related to pregnancy, whether they have taken any previous medication or previous surgery or previous physiotherapy treatment, all those things. So only related to pregnancy. Okay. So all these will be coming under the history taking. So with this itself, you will be getting almost all the details. Okay, so almost all the things you would have got in the history taking itself. Then from the medical records or from the medical case sheet, you need to note down these points. That is their BMI, their blood pressure, their urine analysis result, their blood test result, whether they have edema. If they have edema, then you have to check whether they have bilateral pedal edema or only one hand or one leg. And if they have edema, you need to check whether it is pitting edema or non-pitting edema. Is that clear? Okay. Then if they come to you after 8 weeks, then you can check for fetal movements. So in the medical records, they would have mentioned about the fetal movements. So you can just check the fetal movements. Then fetal heart rate from 8 to 10 weeks. That is after 8 weeks, if they are coming and meeting you, then you can check all those things. Then you can check for the fundal height. So fundal height is height of the fundus. That is above uterus, you will have something called fundus and the height will be noted down. I hope in the theory you would have seen that. So depending on the months, you will be having the fundal height. So for example, if they are 2 months, then the fundus will be just in the lower abdomen. So depending on the fundus, the month, the fundal height will be keep on increasing. So for example, at the 32 or 36 week, the fundus will be at the ziphisternal level. Okay, so the fundus will be at the ziphisternal level. Then after 36 weeks, slowly the fundus will come down because the baby would have just come and get engaged in the uterus. Okay, so that is about the fundus height. So why as a PT we need to know the fundus height means if the baby has any growth retardation, then the fundal height will show you that. So if the fundus height is not according to the particular week, then that means the baby has some growth retardation and physiotherapy is contraindicated. So that's why you need to observe the fundus. Then whether they have undergone any other screening like ultrasound, amniocentesis, chorionic villus sampling, all those things, and what is the result of it. So all these things you will be getting from the medical record. Okay, then. So next is our objective assessment. So first is we need to observe for the posture. So definitely they will be having some postural abnormality. So you need to observe for the posture. You need to check their muscle power. Range of motion maybe generally you can do. You cannot do for all the muscles, and muscle power also generally you can do. You cannot do for all the things. So muscle power you can do for abdomen. You can do for pelvic abdomen and spinal extensors, and you can also do for pelvic floor. Okay, then range of motion just upper limb and lower limb. You can ask them to do. You can do a visual analysis of range of motion. If you find there is definitely reduction, then you can go and check with the goniometer. Otherwise, you can just visually see how is their range of motion. Then sensation, you have to do sensory test according to the dermatome levels. And you have to do compare with both the sides. Check for any abnormality. Okay. So then common like posture, I will go in detail. Okay, later. Then common problems they may have is they may have pain, they may have swelling, stiffness, reduced muscle power. So these are the common problems the mother will be having. Okay. So now you can just see. So there is going to be difference in the posture. So why there will be difference in the posture? Because of the increase in the abdomen. So as the pregnancy increases, the abdomen cavity will be bulging out. So since it is bulging out, the center of gravity, there is the line of gravity which is passing in S2 will be deviated forward or will be pulled forward, and it may fall outside the line of gravity. So to manage this, the mother will undergo a postural change. Okay, so all this is to manage the uh, line of gravity. Is that clear? So the mother will undergo a shift in the posture. So you can see here, this is the normal curvature. There is normal lordosis and kyphosis curve. So this is the normal one. But in pregnant mother, you can just see here, they will be having increased lordosis and kyphosis because the abdomen will be just pulling the spine forward. As the abdomen is pulling the spine forward, there will be increase in the lordosis. So to compensate this increase in the lordosis, the mother will have increase in the kyphosis. Is that clear? So first the change will be in the spine, in the lumbar region. So because of the distending abdomen, the spine will be pulled forward. So when it is pulled forward, that will increase the lordosis. So when it is increased in the lordosis, automatically to compensate that, kyphosis also will be increased. Okay. So then again, when the abdomen is pulling the spine forward, automatically there will be anterior tilt. Okay, so there will be anterior tilt. So normally the pregnant mother initially everybody will have a neutral pelvic, but because of the pregnancy, the tilt will be keep on increasing, and like anterior tilt will be there. Is that clear? And because of this change in posture, and if you see the line of gravity, so this is the normal line of gravity, but here if you see the when this normal line of gravity is there, definitely it is going to come out of the base of support. So to manage that only, they will have all these postural changes. Okay. So when they have this postural changes, you can see the since there is increase in the lordosis, this muscle will undergo tightness and this muscle will undergo weakness. Is that clear? So same like that, this muscle will undergo weakness or stretch. This muscle, anterior muscle, will undergo tightness. Is that clear? So these are the reason for change in posture. Okay, so this is the explanation, and definitely because of the postural change, they will be having change in the gait also. So the pregnant mother will have a pregnancy gait. or it is also called as phantom wandling gait. They will be walking with a broader base of support. Okay, so the base of support will be increasing, and external foot progression also will be increased. Pelvic obliquity will be increasing, pelvic rotation will be increasing, and there will be hyperextension of knee and foot pronation. So these are the changes that will be happening in the gait. Is that clear? So let me show you some videos about the posture, or else let me complete the thing. So these are the common weakened muscles because of the postural changes and because of the other changes in the pregnancy. So neck flexors will become weak. The same wise, neck extensors will become tight. Okay, shoulder retractors and depressors will become weak. That means shoulder protractors and elevators will be tight. Shoulder external rotators will be weak. That means shoulder internal rotators will be tight. Then abdominal muscle will undergo weakness. Pelvic floor muscle will undergo weakness. So that means abdominal spinal extensors will undergo tightness. Okay, so hip extensors and abductors will undergo weakness. Hip flexors and adductors will undergo tightness. Then plantar flexors will undergo weakness. Then dorsiflexors will undergo tightness. Okay, so these are the opposite muscle group that will be undergoing the weakness and tightness. Okay, so before going into the PT management, we will see like how this posture is changing, and as a PT, how to correct them. Okay, so as a physio, how to correct their posture. Okay.
When a woman is pregnant, her pelvis.
So first, you just see what happens in a pregnant mother and why there is change in the posture.
When a woman is pregnant, her pelvis begins to tip backwards as the baby develops.
1 minute.
When a woman is When a woman is pregnant, her pelvis begins to tip backwards as the baby develops to balance the forward weight of the expanding uterus. As the pubic and tailbones move backward, the arch in the lower back increases. As the lower back arch increases, so does the curve in the upper back or thorax. The shoulders and head move forward, and the chest collapses to balance the changing weight. All these changes can increase stress on the spine, exaggerating its natural S shape. Other muscles and ligaments can also be strained.
Okay, so I repeat this video. Watch carefully how the posture changes.
When a woman is pregnant, her pelvis begins to tip backwards as the baby develops to balance the forward weight of the expanding uterus. As the pubic and tailbones move backward, the arch in the lower back increases. As the lower back arch increases, so does the curve in the upper back or thorax. The shoulders and head move forward, and the chest collapses to balance the changing weight. All these changes can increase stress on the spine, exaggerating its natural S shape. Other muscles and ligaments can also be strained.
Okay, so I think now you got an idea how this posture is changing because of the pregnancy. So now we will see what is the management for it, like how to change their posture.
Okay, hi everybody, it's Lorraine from pregnancyexercise.co.nz. Welcome to our YouTube channel, and today's video we're going to have a look at your posture during your pregnancy, how to improve your posture and what to do if you've got bad posture. So we've got two gorgeous models with us today. These are our models. We've got Jenna, who is 25 weeks, is that right? You almost 26 weeks, excellent. And we've got Ria, who's 29 weeks tomorrow. Okay, Ria here is on her third pregnancy, and we've got Jenna on the second pregnancy. So at the moment they're both trying really hard to have good posture. Okay, but last week was a little bit different when we corrected their posture. So what we want to have a look, good posture during pregnancy. Let's have a look at good posture first and why we should have good posture. Good posture is going to help prevent back pain. It's going to help you connect with your core muscles a lot more efficiently, and it's going to help prevent diastasis recti, which is abdominal muscle separation. So to get perfect posture, what we need to do is where they both are is lining up nice and straight. So we're thinking ear, shoulder, and then we will always want to have the rib cage stacked nicely on top of the hip. So it shouldn't be forward, it should be a nice straight line from the rib cage to the pelvis. Okay, and then we go down hip bone, knee and ankle. So if you think about that straight line coming straight down through the center, that plumb line, they would have great posture. Now let's have a look at some postures that are not correct and where they were. This tends to be a typical pregnancy posture, sway back posture, pushing your abdominal muscles forward. So if this is you, what you need to think about is activating your core muscles correctly and just bringing those hips back easily into position throughout the day so that your ribs become nicely stacked on top of your hip bones. Same for Ria. Ria just wants to make sure that she's not leaning back too much. Okay, and we'll just straighten you up. Actually, Ria just needs to tuck her pelvis underneath her just slightly. So what we want to see is a neutral spine, which is a small lumbar lordosis, not an increased one. If you can both just increase that lumbar lordosis, girls. So stick your bums out as if you've got a duck. Okay, so stick your bum out like Donald Duck. Okay, so we don't want to increase lumbar curve because that's also going to put stress on our spines as well. So just tilt under a little bit, Ria. Chest up. Okay, so we need to correct our posture easily throughout the day, and we can do this with different cues, okay, and different tips. So always remember ribs stacked on top of your pelvis, and generally we'd have boobs in front of your abdominal muscles, but during pregnancy this is not going to happen because as your bump grows, okay, so we can't really use that cue. So there you go, that's going to help to improve your posture. Continually check that you're not leaning too far back, have your knees slightly soft. Okay, so if you need any more information, please visit our website, pregnancyexercise.co.nz, and we have more tips and information on staying fit and healthy during your pregnancy.
Okay, so this is for your standing. So I'll show you one more video.
To get yourself into the right posture, firstly, make sure that your head is in alignment with your body. To do this, your neck should be erect and it should appear as part of your spine. Next, contract your abdominal muscles and pull the buttocks slightly inwards. Make sure that your body weight is equally divided between both the feet. Always keep yourself erect and don't let your shoulders droop forward. Open out your chest and throw the shoulder blades backward and slightly downward. Whether you're standing or sitting, always make sure that you keep to this erect position. Right from the beginning of your pregnancy, it is crucial that you develop and maintain a correct posture. This is because as your pregnancy progresses, your center of gravity will shift forward, causing your pelvis to tilt forward and also increase the curve of your lumbar spine. A good posture will increase the room available for your baby to develop and grow. It will relieve you from backaches and breathing difficulties and also make you look and feel better. Pregnant women often round their shoulders and bring their head forward. This can cause shortness in breath and pain in the upper back and shoulders. Be conscious about your posture every time you stand, sit or lie down. Remember, maintaining the right posture will provide you great relief from a number of pregnancy-related discomforts. Take care and have a safe pregnancy.
So these two are about standing. So now we'll see about sitting.
Pelvic health physiotherapist here at Ecophysiotherapy. Welcome back to the 5th video of our pregnancy series. Today's video is strictly a demonstration of sitting postures for during and after pregnancy, and these can be especially helpful if you're experiencing any lower back pain or pelvic girdle pain or pain around the hips. So what I want to start off with today is showing you the position you should try to avoid, especially ladies in your 3rd trimester. This position you want to try as best as possible to not sit in. So the first position is the cross-legged position. One knee over the other knee. Now I don't know about you, but sometimes I like to also even wrap my leg around my leg a second time. This is even more difficult, especially at 35 weeks. This is not a good position because what it does is it kind of compresses the pelvis and can lead to discomfort. But not only that, usually in the 3rd trimester, the baby's head is turning down in toward the pelvis, and that posture actually takes space away from the baby, and we certainly do not want to motivate the baby to change position. We want the baby face down, so, best to just avoid that position. So instead, you can try some of these positions. If you like to cross your legs, what you can do is you can actually cross at the ankles. So for example, crossing with your feet underneath the chair, perfectly fine. Keeps the pelvis open and you can have the legs crossed. Alternatively, you could sit with your legs straight and crossed at the ankles. You just want to make sure that your knees are sort of pointing outwards. So again, kind of keeping the space in the pelvis open. If that position becomes uncomfortable, you can try the sit-up straight position. So that is basically where you come to the edge of the chair, your legs are open, and instead of sort of sitting in a slumped posture, you want to make sure that your chest is up and your shoulders are down. So you're kind of almost trying to pull your shoulders down toward the chair, and you're sitting sort of straight up. If that position becomes tiring or becomes uncomfortable, you could do the sit back with some back support. So you could try using one of these discs. Basically, it allows you to reposition your pelvis and provides your tailbone and your lower back a little bit of cushion. You don't have to. So I'm going to turn sideways.
So I do have the cushion, and I'm just going to place it backwards. I'm going to put my back all the way to the back of the chair, and I'm going to allow it to be supported with my legs open. So just showing you from the front, basically in this type of position where there's lots of space for the baby. Lastly, you can try out this position where you put your ankle over your knee. So you're not crossing your leg, you're kind of opening up the pelvis on one side. You may find this position gets uncomfortable after a bit, but you can then alternatively switch legs. So hopefully you found this video helpful. Test out the postures, and we look forward to seeing you on our next video. Thank you.
Okay, so are you clear about the posture? So do you want one more video or it's enough?
Posture and education for the prevention or management of back pain in pregnancy. So what can we do to manage our different types of back pains? Well, the first would be adopting good postural habits, which I understand is much easier said than done. I will elaborate more in the next few slides. Avoiding high heels. Keep them to less than 1 inch, and platforms are better than pointed heels as they too can change your already shifted center of gravity, making it easier to lose your balance. Use a heat pack or a hot water bottle or even a warm bath. Heat relaxes the muscles, can be pain relieving. Remember though, never to place a heat pack or a hot water bottle directly onto the skin. Always wrap it in a few layers of a towel, and also never place it on your tummy. Keep it on your back. You may leave it on for approximately 20 minutes. General exercises such as pelvic tilts can be very helpful for those with tight muscles, but also can help to strengthen those with weakened abdominal muscles. So let's go back to our postural habits. Have a look at these two photos. Look familiar? In the photo on the right, we see what we call a poking chin. Over time, this can lead to added mechanical stress to the neck and upper back region. We see that her shoulders are also fairly rounded. This can also reduce her ability to take deeper breaths, or may cause her even getting short of breath, as the lungs have less room to expand. The photo on the left depicts a fairly common posture we see if perhaps I'm waiting in a longer queue. She takes more weight on the left leg, thereby putting more strain on the muscles of that side of the body. So what would good standing posture look like? We would have our head pulled up and sitting above our shoulders. Drop your shoulders and pull them slightly back at the shoulder blades. Lift your chest and your ribs. Keep your back upright. Tighten your stomach muscles. Tuck your bum in. Bend your knees slightly. Stand with your feet hip width apart. Now let's have a look at the two photos in sitting with the lower back unsupported and the weight of the baby. This compresses the lower back, and over time, this would lead to back pain. Also, having slid forwards on the chair, the thighs are also unsupported, thus making it unsafe, easier to slide off the chair. On the left, that poking chin is still visible. Shoulders are rounded, and the feet are off the ground and not resting. and depending on your lordosis, without any back support, this can become uncomfortable and achy. So let's see what good sitting posture would look like. An ideal chair is one with good back support for your back, holding the back upright. It should allow support for your thighs, allow your knees to relax at right angles, your feet to rest flat on the floor. You can use a back roll or a small cushion at your lower back, which will help to maintain the natural curve of the lower back when sitting down. The way we bend to lift and pick things up can also affect us. Imagine picking up your laundry basket or reaching for that shopping bag on the floor. Common errors are, for example, the photo on the right, keeping the object too far away from us, especially if it is heavy. Or in the photo on the left, though there is more effort here to bend the knees and keep the object closer, the rounding of the back can lead to unwanted added mechanical stress to the lower back. So how would we pick up something from the floor? What's a good lifting technique? You would want to start by pulling your tummy muscles in. So imagine you draw your belly button in towards your spine. Tuck your buttocks in, tighten your pelvic floor muscles, and keep your spine straight. Step into a half kneel position and bring the weight close to your body. This is especially important if what you're picking up is heavy. Using strong thighs instead of your smaller back muscles and ligaments, push through your legs and stand up. How about when we carry things? In the photo, we see that to compensate for the heavy bags on the left, she bends and leans her body towards the right, putting a stretch on the muscles on the left and compressing those on the right. How should we carry? We would want to distribute your load evenly, decrease the load through several trips, or get someone to help you if you can, or use a backpack type of handbag, and this would help redistribute the load evenly. Should you have any burning questions about taking care of yourself during pregnancy and after delivery, please email your questions to
Okay, so this is about the ergonomics also. So you not only you have to teach them the correct posture, and when you are teaching them the correct posture, you have to make sure that you are making them to stand in front of the mirror. So this will help them to get a clear picture how they are standing and what is correct and what is wrong. Okay, so you need to teach them exactly like how they look and how they should not look like. So both the things you have to teach them so that they correct themselves. So this is one. The next thing is you need to teach their ergonomics according to their work. So for example, if a person is working in a factory, then you have to teach according to their occupation so that they don't stress their knee, they don't damage their back, all these things. Then if they are like working in a very sedentary lifestyle, like a software engineer where she used to sit for a long time, then you concentrate mainly on the sitting ergonomics. So posture correction will not happen unless and until they do a good ergonomics. That is very, very important. So this has to be like a habitual. They need to have a habitual good ergonomics so that they don't hurt their back as well as they don't change their posture. So for example, if they are keep on practicing a bad ergonomics and in front of the mirror, if they come and try to correct their posture, they cannot do it. Okay, so it is the posture is because of the things they are doing. So this particular point you need to keep on stress them so that they don't they don't do a bad ergonomics and just correct their posture alone. Is that clear? So we'll continue the slide. So the first thing in the PT antenatal management is posture correction. The next is like you need to, in posture correction, I have given in the slides, I have given the explanation for whatever you saw in the video. Is that clear? So all these things only you saw in the video. So I have given all those explanations. Okay. So next is about the strengthening the weak muscles. So you need to strengthen the weak muscles. For that, you have to see what are the muscles that are affected. So already we have seen the common muscles which are weak. So we need to strengthen all these muscles and we need to stretch all these muscles. Okay, so now we will see how to stretch and how to strengthen that. Do you want a break for 5-10 minutes or continue the class? Girls, do you want break or continue the class?
Break 5 minutes, miss.
Okay, okay. So we'll start by 12:05. So can we start?
Yes, miss.
Can you see me?
Yes, miss.
So these exercises, I will try to demonstrate myself. Then later I'll send you the videos. Okay, so because all these exercises you would have learned in exercise therapy. So I'll just demonstrate now. Later you can see, like if you want the videos, then I'll send you the videos. Okay, so I don't want to waste much time in this in watching video, because all these are simple exercises. Is it clear? So first is first weak muscle is isometric neck flexors. So to strengthen neck flexors, we need to go with isometric neck flexors. So isometric neck flexors are, so you need to do, so you need to do like this. You need to keep the hand, both the hands behind, and the neck should be straight. Okay, so you have to tell them that the neck should be straight. They should not like flex the neck like that, or they should not keep it in extension. So the neck should be neutral. Keep both the hands behind. Then you have to just push the neck behind. At the same time, hold the, like push the hands in the front. So that means the isometric neck exercises is just push the head as well as push the hand. So both should be equal in such a way that there should not be any movement. So this is your isometric neck extensors. So push it, hold for 10 counts or 7 seconds. So hold for 10 counts or 7 seconds, then relax. So same like that on all 4 directions. So on the right side, hold it neutrally, then push the neck as well as push the hands. So don't push like this, it is wrong, or don't push like this, it is wrong. So hold the hand straight over the ears so that completely the neck will be in neutral and you will be able to push. So push, hold for 10 seconds, then relax. Then in the other side, then in the anterior side. So anterior side, you can hold at the forehead, then give a push. So this is your isometric neck exercises. So if you want to do only neck extensors, also you can do it. But mostly, since this neck muscles are cervical muscles will be like will be having multiple action. So that's why we are doing for all four sides: neck flexors, extensors, and side flexors, because this muscles are small and it will be having multiple action. Is that clear? So this is for your isometric neck extensor flexors. The next is you need to the next is like the scapular muscles. So especially your shoulder retractors will be weak and protractors will be tight. That means your pectoralis major and minor will be tight, and scapular muscles will be weak. So to strengthen the scapular muscles, you can use a TheraBand. Okay, so this is your TheraBand. I hope you would have seen in exercise therapy. So this is the TheraBand. You can make them to hold the TheraBand in the hand with shoulder width. They should not hold it like this. They should not hold it too closer. Okay, so they have to hold the TheraBand in the hand at the shoulder width. Okay, so at the shoulder width you have to hold it. Then do retraction. Okay, do retraction, hold for 10 seconds, then relax. Do retraction, hold for 10 seconds and relax. So this one you can use the rubber, you can use any other elastic material to do this. So depending on the patient's muscle power, you need to you can use either a heavier TheraBand or medium or lightweight, like that, light resistance, like that. So you have four different colors in the TheraBand. So light, medium, and heavy, then strong, heavy, like that. So you can use a medium one for the patient person. Then slowly you can ask them to increase to the heaviest one. That clear? Okay, so this is for your shoulder retractors. That is your rhomboids muscle. So rhomboids muscle action is shoulder retraction. This action. Okay, so for that you can use the TheraBand. Then next muscle is shoulder external rotators. So if you see their shoulder will be internally rotated, and the hands will just be in the forward position. Okay, so this is normal, neutral. This is retraction. This is protraction. So the shoulder, because of the tightness in the pectoralis major and minor, the shoulder will be pulled forward. So the hands also will be in internal rotated position. So you need to strengthen the external rotators. Okay, so strengthen the shoulder external rotators. So for that also you can use the TheraBand. You can make sure that the hand is in this position. Then you have to make them to do this. Okay, so you can hold the TheraBand in one hand, then with the other hand you have to make them to do shoulder external rotation. So you can make them to do this external rotation even with the help of a dumbbell or with the help of any other mechanical equipment. Is that clear? So you can, this is your external rotation movement. So this movement you need to strengthen. So you use a TheraBand, use any kind of mechanical equipment you can use, and you can do external rotation, strengthen external rotation. So at the same time, you need to do some relaxing also. So this also you can do. So you can keep them, ask them to keep the hand on the shoulder like this. Then do clockwise rotation. Okay, so clockwise rotation, then anti-clockwise, then ask them to bring forward and backward. So this also you can do. So this exercise will relax your shoulder, chest muscles, and this exercise will strengthen your scapular muscles. Is that clear? So this is for your strengthening your scapular muscles. So do you want me to repeat? You will start with isometric neck exercises. So you will be doing all four side isometric neck exercises. Then you go with scapular muscles. So for scapular muscles, you can do this shoulder anti-clockwise, clockwise, then bring in front and take it back. Plus, you can give them the TheraBand and you can make them to do the rhomboids exercises. Okay, so this is for your scapula. Then for shoulder external rotators, you can use the TheraBand, you can use the dumbbell and you can make them to do shoulder external rotation. Okay, so this is for your upper thoracic. Then next is your abdominal muscles. So abdominal muscles, so since the person is pregnant, definitely the muscles will be going on, like that muscles will uh, become weaker. That means like gradually the muscles will become weaker and weaker. So like you don't need to stress much about the abdominal exercises in the antenatal time, but still you can ask them to do isometric abdominal exercises. Don't give them all the grade 4 grade 5 exercises. They will not be able to do it, and even if they are doing also, there won't be much result. So you can make them to do simple like grade 2 and grade 3 exercises. Don't give grade 4 and grade 5 exercises. So for isometric abdominal exercises, you can position the person in crook lying, then ask them to just tuck in the abdomen inside. Okay, so tuck in the abdomen inside, hold for 10 seconds, then relax. So this one, after second trimester, you will not be able to do it in the crook lying. So you can make them to do this exercise in sitting and standing. So isometric, just pull in the abdomen, hold for 10 seconds, then relax. Pull in the abdomen, hold for 10 seconds and relax. So this is your isometric abdominal exercises. Then graded abdominal exercises, grade 2 will be in crook lying. Keep the hands over the sides and make the person to come up, lift up. So that will be your grade 2. Grade 3 will be keeping the hands over the knees and coming up. So when they are coming up, you have to instruct that do not see the ceiling. They have to see the ceiling and come up. Do not flex the neck. Okay, so they should not flex the neck too much. They have to look up the ceiling and come up. Okay, so that will be grade 3. The next is for pelvic floor muscles. So for this, you have to teach them correctly. So they should know what is the pelvic floor muscle. So what you can do is, you make the person to sit on the chair. Okay, so make a person to sit on the chair, or you just make the person to sit on the edge of the chair. Then you can ask them, the part that is touching the chair will be the pelvic floor muscle. Okay, so how you can make them to understand this, make them to sit on the chair with the uh, with the thighs apart. Okay, so make them to sit on the chair with the thighs apart. Then you can ask them, so the part that is touching the chair will be the pelvic floor muscle. Okay, so in that position, let them just squeeze the pelvic floor. That means let them just do as if they are stopping the urine and fecus. So they have to do in such a way that they are stopping the urine and fecus. Okay, so I will just show you the picture. Okay, so can you see here? So this is in lying. So in sitting, so if you see here in sitting, so the part that is touching the chair is your pelvic floor. Okay, so they have to do as if they are stopping the urine and feces. So if they do that, they can feel some muscle is pulled inside. Okay, so the muscle will be closing, and as well as it will be just pulling up. Okay, so the muscle will be just closing, and as well as it will be pulling up. So that is your pelvic floor muscle. Okay, so it should be like this. So if you just lie down, you tighten your pelvic floor muscle starting from the anus and as a stopping the wind. Then just tense your vagina as well as tense your uh, like urethra. So close all three opening and hold for 5 to 10 seconds, then relax. So that is your pelvic floor muscle. So this has many types, like two types of exercises are there. One is fast type, another one is slow. So fast is you contract, relax. So that is your fast muscle. Okay. So you all can just try in the chair. If you're sitting, you just sit down, keep the thighs a little bit apart, and you can feel a muscle that is touching the chair. So that will be your pelvic floor muscle. Then try to squeeze that particular muscle. So you will feel as if the muscle is going up. Is that clear? So if you contract, immediately relax, that is your fast muscle. If you contract and hold for 10 seconds, then that is your slow. Then you can also do a mixed method. Mixed means too fast, too slow, too fast, too slow, like that. So that will be your mixed method. Okay, so that is your pelvic floor muscle. Then you're strengthening your hip extensors and abductors. So this one you can do in using a TheraBand. This one you can also do using a dumbbell and other thing. So in TheraBand you can tie the TheraBand over the lower leg and you can hold the chair and do hip extension and hip abduction. You can also do this with a dumbbell and weight cuff. Is that clear? So same thing for ankle plantar flexors. So ankle plantar flexors, you can make them to sit in high sitting, then tie the weight cuff or dumbbell, then make them to do plantar flexion. Okay, so this is your strengthening the plantar flexion. So these are the strengthening exercises. These are the usual strengthening exercises you will be doing. But if the person doesn't have that particular weakness, then no need to do. Okay, so it doesn't mean all the pregnant mothers will have all these problems. It is not like that. So some people will have, some people will not have it. So depending on the patient only, you have to teach them. I'm just teaching the general muscles which will be weaker. Okay, then next is for stretching. So stretching, you need to stretch your upper neck extensors. So, so to teach stretch neck extensors, you need to do neck flexion. So you can stretch your SEM, that is scalenogledomastoid muscle. You can make them to sit. You can ask them to do complete neck flexion. So when they do a complete neck flexion, automatically neck extensors will be stretched. So this is one exercises. Then you can also stretch SCM. You can also stretch upper trapezius. So all these muscles will help you to relax your extensor muscle. Is that clear? Then for scapular protractors, that is your to stretch your pectoralis major and minor. So to stretch your pectoralis major and minor, you need to make them to stand at a corner of a room. So they can keep one hand on one side, one wall, another hand on another wall. Then they can do the stretching. Okay, so I'll show you the video later. So that is for your pectoralis major stretching. Okay, then for shoulder internal rotators, you can do shoulder external rotation, or you can also hold the hand behind and you can do internal external rotation. So that also will help you to stretch shoulder internal rotation. Then low back, you cannot position the patient in prone lying and do the stretching. Instead, you can ask them to stand and do hyper extension. Okay, so that will help you to stretch the muscle. Then perineal muscle, you have to, you cannot go do self stretching. You have to palpate using the thumb and you can just stretch the perineal muscles. That also I will show you the video. Okay, then hip flexors and adductor stretching. Hip flexors is your rectus femoris stretching and adductors, hip adductor stretching. So I think you know, but anyways, I'll show you the videos for all these stretching. So all these things you need to do self stretching. You need to teach them self stretching because they need to go back and do the stretching at home. So don't teach passive stretching. Go for self stretching. Is that clear? So this is like when you say antenatal, so sometimes the patient may come to you with some problems so that you can assess them and you can give them the treatment. Sometimes you need to conduct an antenatal class. Okay, so when you say antenatal class, so normally the antenatal class is done. So normally the antenatal class is done at the 32 to 36 weeks. Okay, so normally it is done at the 32 to 36 weeks. So it will be done in a group. It will not be done in a single, individually, it will be done in a group. So you can make some 8 couples. So normally you need to ask the person to come with the partner because you need to teach them many things where the partner will be helping them. So you ask them to come as a couple. So you can just make a small group where 8 to 16 people. That means if you put 8 couples, that means you will have 16 people. Don't make more people. One person can look after only 8 couples. So if you have more therapists, then you can make it a bigger group. But ideal is 8 people, 8 couples, so that it is easy for you to monitor and teach them. So this is a 6 weeks program. So in the 6 weeks program, I think Dr. Deepthi would have taken the theory. Okay, so I'll just go with the practical aspect alone. So in the 6 weeks program, week 1, you need to teach them first you need to have the ice breaking session. I hope you know what is ice breaking session. The ice breaking session is just to make them to mingle within each other. So ask them to talk within each other so that they will be talking and they will be talking about their problems. Once they know that even for all the pregnant women, they have the same problem, then they will be happy. Happy in sense they will not be worried much. Otherwise, usually the female mentality is whenever a problem comes, she will think, okay, only for me it happens. So it is in pregnancy, it is nothing like that. So when you ask them to mingle with each other, they will talk and they will feel that, okay, everybody has this problem. So that means it is not something weird, it is common. Okay, so for that only, you just need to have a ice breaking session. So after ice breaking session, in the first week, you need to teach them all the exercises. So all the exercises means whichever exercises now we have seen. Our neck exercises, pelvic floor exercises, abdomen exercises, all those exercises you need to teach them. Okay, so that is in the first week. So especially the posture correction and other things. So these you can also demonstrate with the picture so that it is easy for them to understand well. So which is good posture, which is bad posture, all those things. So regarding the posture, you have to teach them. Then if they have any other problems like any other pregnancy discomforts like SA joint pain, incontinence, symphysis pubis dysfunction, cramps, for those also you can teach them the exercises. Okay, so I forgot about one exercises, that is pelvic tilting exercises, which is very, very important. So pelvic tilting exercises, don't teach them in lying, you have to teach them in sitting. So in sitting, you need to make them to rock the pelvis forward and backward. Okay, so rock the pelvis forward and backward. So this is pelvic tilting exercise in sitting. This is in standing. Then cat and camel. So that will be your quadruped position. Okay, so cat and camel will be your quadruped position. So in the first week, you will be teaching them all those things. These are some of the relaxation positions for them to lie down, but they cannot go for this position after the second trimester. All these position, all the other three, they can go. Okay, so that is will be in the week 1. So week 2 will be, you need to teach about labor. So I hope you know labor has 3 stages: stage 1, stage 2, and stage 3. And in stage 1, you have 3 phases: phase 1, phase 2, and phase 3. Okay, so in the week 2, you need to teach what and all that will be happening in week 1. Okay, in the week 2, you need to teach them what and all it will happen in the second phase. Okay, so especially in the week 1, in the first phase, you will be teaching something called focused breathing. Okay, so um, focus breathing is, you need to make them to focus on a particular object, then make them to do the breathing exercise. So the breathing exercise is something like you need to do deep, initially when the pain begins, they have to do a deep breathing. Then after that, they have to do 3 or 4 shallow breathing. Then at the end, again, they have to do a deep breathing. So this 2 deep breathing is called as cleansing breathing. Okay, then other is a shallow breathing. So it will be like this. So this is a deep breathing or cleansing breathing when the pain begins, then shallow breathing, then again deep breathing. So this is to make sure that they are not hyperventilating during the pain. So in the first stage, in the first phase, their pain will be mild, so they should not hyperventilate. They have to go along with the contraction. So this breathing is called as focused breathing or de-stressor breathing. Okay, then so this type of breathing you will be teaching. Then next is, you will be teaching them relaxation technique. So relaxation technique can be like, you can teach them, they can go for a shower, they can go for a walk, they can go for listening music and all those things. So that will be the week 1 relaxation. So they can go for showering, they can go for listening music, they can go for walk, another thing, because the pain will be very less during the first phase. So they can do all these things. So these are the relaxation you will be doing in the first phase of first stage of labor. Then in the third week, you will be teaching the second phase. Second phase will be like little more severe. Okay, so little more severe, and they can just continue the same type of breathing. You can also add up other distraction techniques like relaxation, like a visual relaxation technique. You can also give them tense. You can teach them some positions, breathing awareness, and massage and visualization. So these are some of the positions that will be helpful during the first stage of labor. Okay, so imagine, just keep in mind, first stage of labor will have 3 phases. So all 3 phases you can ask them to be in these positions. So these positions will be very helpful for them. Then you can ask the partners to do massage. So especially in the first stage, the pain will be from T11 till L2. So the pain will be from T11 till L2. So you can ask them to do stroking. You can ask them to do effleurage. Stroking will be from proximal to distal. Then you can ask them to do effleurage. Then you can ask them to do circular kneading. So circular kneading, either they can use the fingers or they can use the physio ball or tennis ball. Okay, they can do massage over that. So this massage, you make sure you are teaching to the partner, and the partner is doing it. Okay, so that is very important. So some other positions are, these are some of the other positions which you can do during the first stage of labor. So you have to keep in mind, in the first stage of labor, normally the effacement will be very less. So so you should not go for towards gravity position. You will be going somewhat counterbalancing gravity position. Okay, so only in the second stage you will be going towards gravity position, like squatting, another thing. But in the first stage you will be going eliminate a gravity position. So you can teach few of these kind of positions to them, so that they can do and they can relax themselves during the first stage of labor. Okay, so here in the third the second phase, they have to the pain will be further increasing. So what they have to do is they can just add up some vocals. Vocals means just a sound, making sound. So when you are making sounds, automatically the mother will get distracted from the pain and she will be concentrating in the breathing. So this will help them to reduce the pain, as well as this will help them to go for good go for good descending of the baby. Okay, so here when the pain begins, they have to do a cleansing breath. Okay, so when the pain begins, they have to do a cleansing breath. Then they have to go for a shallow breath. So in the shallow breath, when they are taking the breath inside through mouth, they have to do a he sound, like he. Okay, just a he sound, like that. So that is taking in. Then they with ha ha sound, they have to breathe out, ha, like that. So when they're taking in, they have to do a he sound. When they're bringing it out, they will be doing a ha ha sound. So this will help them uh, 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 to uh, to decrease the hyperventilation. So during pain, definitely they will go for a hyperventilation. So this is done especially to decrease the hyperventilation. Is that clear? So with this he he ha ha, they will be able to phase the breathing along with the contraction. Phase the breathing means like not hyperventilating, not Wells over maneuver. They will be able to decrease the respiratory rate. Okay, so all these things you will be teaching in the third week. So this is in the massage. So massage, you will be doing this area. So the pain will be over this area in the first stage. So you can do stroking from proximal to distal, effleurage from distal to proximal, like this on both sides. Then circular kneading, like single circular kneading and double circular kneading over this area. So the pain will be from T11 to L1. So you have to concentrate on this area during the first stage. Okay. So then in the third phase, that is called as transition breathing. So here what you do was, you will be doing the same kind of breathing, but in between you will be having a pat pat. So again, this is also to increase, to face with the pain and to decrease the number of breaths taken. Okay, so I will show you videos for all these things. Okay, so that's why I'm going. Then in the fourth week, you will be teaching them what are the other pain relieving techniques. So other pain relieving techniques means medications, injections which you can use to reduce the pain. So you have to teach what is the pros and cons of each medication. But if you see, epidurals only will have very uh, uh, less disadvantages. So that's why mainly they go for epidurals, because in epidurals they will be able to go for the normal delivery. But other medications, it may hinder the normal progress of the labor. So that's why you can use epidurals, and you can mainly you will be going with epidurals. Okay, then you can also discuss about what are the different positions they can do in the second stage, and what are the assisted methods they have in delivery. So in the second stage, these are the positions they have to do, and in these positions they have to do one kind of breathing exercise that will be helping them to push. Okay, so one kind of breathing exercise that will be helping them to push down the baby. So they have to do a deep breathing, then they have to push down the baby, then they have to exhale. Okay, so second stage of breathing exercise is totally different from what is the other three. Okay, so take in deep breath, then push down the baby, then breathe out. It is also called as J breathing. Okay, so these are the things you will teach in the fourth week. Then in the second stage of labor, the pain will be mainly over T12 to S2. So you need to concentrate, the pain will be more over the lower back. So you need to teach them to do massage over the lower back. Okay, so stroking from proximal to distal, effleurage and the sides, then circular kneading on both the lower back. Okay, then you can also do massage over the abdomen. This is to relax the abdomen. So this is stroking, lateral stroking, and this is stroking. This is also stroking. So this lateral stroking and stroking will help you to relax the abdomen and help you to bear down the baby. Okay, so these things you will then next is regarding the tense. So tense, you will be placing the tense at T11 to T12. So you will be placing two pads, T11 to T12, one pad, and on the other side, T11 to T12, you will have the other pad. So this is during the first stage of labor. In the second stage, since the pain is very severe, you will be taking it from T10 to L1, you will place one pad, and S2 to S4, you will place other pad. Okay, so T10 to T11, one pad, S2 to S12, S4, you will place the other pad. Then you can use either mode, burst mode or brief mode. So you can teach the mother how to increase and decrease the intensity. So you can fix the pad and you can give the tense to the mother. Then she will be increasing and decreasing the tense according to the pain she is having. Is that clear? Then in the fifth stage, you will be teaching about the third stage of delivery, that is the passive stage. Then you will teach what will happen in the cesarean delivery. Then you can also teach them breastfeeding technique. Okay, so that is in the fifth week. Then sixth week, you will be teaching about the postnatal exercises. So that is in the sixth week. Okay, so let me just show you some of the videos regarding the breathing and the antenatal classes. Okay, so breastfeeding, you need to teach them the positions for position of breastfeeding. And in the sixth week, you have to teach something postnatal exercises. Okay, so again, we will be seeing all these things. Okay, and I think you had theory. That's why I just rushed up with the theory aspect. So we will concentrate more on the videos practical aspect. Okay, so that's why I just rushed up. First, we will see about the breathing.
A second to imagine a woman in labor. How is she breathing? If you are picturing anything like you've seen in TV shows or in movies, she's probably hyperventilating or she's holding her breath completely, which are two breathing techniques that you really want to try to avoid during labor. So in this video, I want to show you breathing techniques that are going to take you from the beginning of your labor all the way to the end of labor. Correct breathing during labor is one of the best tools that you can use in order to have a smooth labor. But breathing comes so automatically that we oftentimes don't even think about it during labor. You know, we use it during the day when we're grocery shopping, when we're showering, when we're cooking. Like, we use it all the time. We don't think about it. However, when pain enters the body, our natural response with our breathing in response to pain is to either hold our breath or to hyperventilate. And like I said, those those are two breathing techniques that you don't want to use in labor. So what we need to do is take breathing from an automatic thing that we do into a manual thing that we do through our contractions, which are causing us a lot of discomfort. So the first breath that I want to show you is called the de-stressor breath, and you can start it in early labor and do it through active labor and even into transition. And basically what it is a breath that takes away the stress and helps you relax. It's a deep breath in and a long exhale. And so I'm going to show you how to do it, and then I'm going to count for you, and then we're going to do it together. So I'm going to put my hands on my tummy, and the reason that I'm doing that is to remind myself to fill up my tummy, my whole diaphragm, with air. I'm focusing my breath and my energy to where my baby is, because remember, you're in labor. That's where your baby is. That's where your contractions are happening. So that's where you want to focus your breath and energy. A lot of people just focus on breathing in their lungs, but by putting your hands on your tummy, you are practicing to engage your energy and breath there. So our hands are on our tummy, and as you breathe in, I want you to expand your tummy like a balloon. We are going to breathe in for 4 to 6 seconds and exhale for 6 to 8. And the reason why I give you that little bit of time is because some women aren't going to be as comfortable doing it as long or as short as others. So just do what's comfortable for you. We are going to practice 4 inhale and 6 exhale. So we're just going to do that together. So as you're inhaling, you want to inhale through your nose, and this is going to help you breathe at a more steady and calming rate. And as you exhale, you're going to exhale quietly through your mouth. So let's start. First one, I'm just going to count for you. So let's get started. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Okay, let's do it together. So you want to be relaxed. Remember, you're expanding your tummy as you inhale and exhaling through your mouth all of that tension. So let's do this together. Inhale. Exhale. Inhale, exhale, inhale, exhale, last time, inhale, exhale, awesome. If you notice, we did that breathing exercise 4 times in a row, and the reason why we do that is because doing it 4 times is going to help you get through those contractions, which are lasting about 45 to 60 seconds during that active stage of labor. And so doing it for that amount of time, like doing the breathing for that amount of time, is going to get you from beginning at least towards the end of the contraction as the pain is going down. So you have made it out of active labor and you are now in transition. And transition is the hardest part of labor, but it's also the shortest. So your contractions are about 60 to 90 seconds long and are 2 minutes apart. So they are coming fast and they are coming hard. And so breathing manually is going to be really, really important for you. Your cervix is doing the last little bit of dilation in order to get to 10 centimeters so you can push that baby out. And right now, a lot of women experience the urge to push at this point. But if they start pushing, the chance of tearing is pretty high, and of course you want to avoid that. So I want to teach you a type of breathing that is going to help you avoid pushing and resisting that urge. So that breath is just a short, shallow breath, as opposed to the long inhale, the deep inhale, and the long exhale of the de-stressor. So that's going to encourage the sensation to, or that urge to bear down. And remember, we want to avoid that at this point. So this breath is just a short, shallow one. So So that's the kind of breath that you want to be doing. You might be thinking, that sounds kind of like you're hyperventilating, but it's not. Hyperventilating is like You're taking 2 shallow but purposeful breaths in and 2 shallow but purposeful breaths out. So let's do it again. And that's how you'll get through transition to resist the urge to bear down. Now, if you're not feeling like you need to bear down, but you're still just trying to get through those contractions, go back to that de-stressor breath and keep doing that until the pushing stage. So during this pushing stage of labor, the inclination for a lot of women is to hold their breath as they're bearing down and pushing. But this causes a lot of unnecessary tension and pressure on the vaginal walls, which can potentially lead to tearing. So a better way to push your baby out without holding your breath is to do the J breath, and I'm going to explain how to do that. So this J breath is a lot more flexible than the distressor breath that we did that I had you count in and exhale for a certain amount of time. This one, at this stage, I really want you to do what's most comfortable for you. So you're going to either breathe in deeply through your mouth or your nose. Remember, your nose is going to probably help you stay more calm and have a more steady breath, but do what's more comfortable for you at this point. And you want to breathe in, so you're expanding your belly, but breathe deeply and comfortably. And as you exhale, you're going to create a low groan in the back of your throat. And you just want to envision that low groan going all the way down to your uterus, down your birth canal, and then out through your vagina, because that's creating that nice J sweep. And that's the motion that we want the baby to be making his or her way out of. So I'm going to take a breath through my nose and create that low groan, and that as I'm breathing down, I want to make sure that I'm tightening my abs or my uterus to help squeeze and get that baby lower and out. So let's breathe together. Remember, you don't have to do it exactly like me. It is very flexible with this J breathing, whatever is comfortable for you. All right, let's do the breath together. Okay, let's breathe in and out. Ooh. Okay, I know that breath sounded a little bit funny, like I was mooing, but that's a good sound to be making. Remember, I was taking all that energy from the back of my throat and sending it to my baby in my uterus, in the birth canal, and sending it out in that low, deep J breath. And if you do that consistently through those contractions at the end as you're pushing, you are going to have an easier delivery as you are breathing your baby out instead of holding your breath and bearing down. So a little extra tip for you, if you want to really practice and nail down this breathing technique, do it when no one's home while you are pooping, which I know sounds really weird, but it's probably the closest sensation to what birthing is going to feel like if you've never done it before. So I know it sounds silly, but it really does help. So practice this breathing technique while you're sitting on the toilet. Thanks for watching this. I hope that you learned something about breathing techniques and that you'll be able to take that into the laboring space, and that while you're feeling discomfort, that you don't let your body go into automatic mode and start hyperventilating or holding your breath, but you'll go into manual mode and you'll feel really confident and empowered in your breathing to get you through all your contractions from beginning to the end of your labor. So again, thank you for watching. Make sure you subscribe to this channel. If you have any questions, comment them below, hit the subscribe and the little bell so that you don't miss my videos in the future, and I will see you next time. Bye.
Okay, so this J breath is the breath holding, like pushing down breathing. You have to teach them in the second stage of labor. All other breathing technique you have to teach them in the first stage, for the first stage of labor. Okay. So few more videos to make you more understand more about the breathing technique.
video is an educational guide for pregnant women and their families. All visuals are for demonstration purposes only. Your labor and birth experience may be different. This video is not intended to replace any medical exam or consultation with your doctor or midwife. We recommend that you practice these methods at home to get used to them before going to the hospital in labor. As your pregnancy progresses, one of the most important things you can practice before you go into labor is breathing. Deep, slow, and rhythmic breathing brings oxygen to your muscles and uterus while relieving tension and stress, making each contraction more productive and comfortable. For pregnancy, deep, slow, rhythmic breathing can bring about a sense of calm and peace. With each breath, you should feel safe and supported. Be in the moment. Deep, slow, rhythmic breathing gives you a focal point that takes your mind off your pain or discomfort. It also makes time go by faster. If you feel dizzy or lightheaded, you should begin to breathe from your belly, filling your lungs fully and completely. Do not shorten your breath, as that can lead to hyperventilation. Vocalization is very helpful. Low, guttural sounds are more beneficial for labor than high-pitched sounds. Inhales are usually quiet. Exhales can be vocal. This could mean letting out a deep sigh, moaning, groaning, or blowing out air. Do whatever makes you feel good. Let's start with practicing the basic cleansing breath. Pull in a deep breath through your nose and release the breath out through your mouth. We suggest you do this at the beginning and end of each contraction. Think of it as a welcoming or signaling breath for your body to release and relax at the beginning of a contraction. And at the end, the cleansing breath releases any remaining tension in your body and indicates the contraction is over. Slow and rhythmic breathing can help you focus during a contraction. Any breathing that becomes rhythmic and slow will help your body relax. Slowly pull in a deep breath from your belly. Your abdomen will rise and fall with each breath. You can even try counting your breaths or adding imagery to them. Another technique might be to shorten your breathing at rib cage level or higher. Pull in a quick, short breath through your nose. When you feel your rib cage expand, immediately release a quick, short breath through your mouth. A modified version of this is to add some light panting at the peak of each contraction, like you're blowing out a candle. Panting or blowing during pushing can ease your baby out as the head begins to crown. This helps to prevent or minimize tearing. Whatever method you choose, don't forget your breathing. This should be nice and rhythmic, free and easy. Breathe how it feels good for you. Start and end each contraction with a cleansing breath. In between cleansing breaths, try a breathing pattern. For mild to moderate contractions, try using slow breathing techniques that may assist you in focusing and reducing tension. You may need to try several to learn what works best for you. This is a series of slow and rhythmic breaths that become deeper and longer as the intensity of your contractions increase, peak, and go away. As your labor advances, your contractions may be more uncomfortable, so try paced breathing. When tension develops in muscles, shorter, quicker breaths such as upper chest breathing can be helpful. Welcome the contraction with a cleansing breath. As your contraction peaks, do short, light breaths in and out of your mouth. End with a cleansing breath. You can also try pattern breathing. Welcome the contraction with a cleansing breath. Take light, short breaths through your mouth. After a few breaths in a row, let out a longer breath, almost like you're saying the word "hoo" or blowing out a candle. Repeat this pattern until your contraction is over. End with a cleansing breath. These techniques and patterns are only suggestions. You can adapt them to whatever is most comfortable for you. Follow your body and breathe in a way that is comfortable. To be prepared, we recommend that you practice beforehand so that it becomes almost second nature. Your partner should also be familiar with all of these techniques. He or she can help you keep rhythm, offer suggestions, and be a source of encouragement. Remember, when you're feeling overwhelmed and exhausted during your pregnancy, just breathe.
Okay, I think you got an idea about the breathing exercise, isn't it? Any doubt in the breathing exercise?
No.
Okay, so let me just show you how antenatal class will be. Okay, so we have seen 6 weeks we will be teaching the antenatal classes. 6 weeks means like it may be in a week they may have 2 or 3 hours. So it is not a single 1 hour. So in a week they will have 2 or 3 hours. Just to show you how it will be, I'll show you share you one video, but the video is for 1 hour. But I just want to show you a short clipping in that. So later I will upload it in the LMS so that you can watch the complete video. Is that clear?
Yes,
Yes.
miss.
Classes. My name's Marjorie. I'll be your teacher today. And I put my name up here, Marjorie Letson. And anytime you have a question, anytime you want to reach me, probably the fastest way after this class is over is just email me. And this goes directly to my phone. So that's letson4@cox.net. And you're in the BLAST class today, and you're basically covering the whole curriculum in one day. Isn't that amazing? So we're going to go through class 1, class 2, class 3, and we're also videotaping this today. So I want to thank you all for volunteering to be part of this videotape class. And I appreciate it a lot. And we hope that this class will be used by people that maybe can't take the classes. And also sometimes I have couples that have taken the classes, but then they go, oh, can you go over that breathing over the phone again with me? And I go, okay, take a deep cleansing breath. But somehow it's going to be a lot easier if they say, oh, I'll just go to class 1 and watch how you did the breathing. So I think that this will be a really nice service to other expected couples. So thank you so much for volunteering. And Brenda's over there. Brenda is my co-childbirth educator. So she's going to be here today to not only help with the demonstration of the exercises and positioning, but also just, here as support for you. We usually have our classes a little bit larger than this, usually 7 to 10. So you're going to get a lot. You're the kind of person that does like to write in your notebook. That's been a huge before we go to lunch. When you come back from lunch, we're for the birth of the baby. The comfort you're going to be able to give Fatima.
Well equipped for when the baby's here.
Management. I heard by to your working mind, also focus on the relaxation and but one is after the baby's born. 16. It's the first trimester. And that's really, it's amazing the change.
They can nap in an area.
Do you ever feel like sometimes it's stretching? Very, very close to have rotate the pelvic bowl forward and back. Soft and stretch. Go back and go like, how do you do that exercise? And we have fat stores more. And 100 grams of protein a day. Things to make sure that you do fluid. And this amniotic ways, you could be all having these pre-signs. You're good. Midwife doesn't tell you. Be sure to ask. Also more Braxton Hicks. Braxton water bag is actually the amniotic. All their instructions. Now, if the water was one, stage 2 is pushing, and then stage 3 is the delivery of the placenta. And we're also going to be in this section practicing the breathing techniques for stage 1 labor. So first of all, you're kind of figuring out like, what's the difference between true labor or false labor? When do I go to the hospital? And you know what to use them when you're in labor and find out what slice. And then transition is the end of stage 1. Something to drink. So you're going to be very busy during this time really distracting her by doing activities that she wants to do. So, timing contractions, I'm going to do the first contraction. And what you're going to do is just time my contraction. So just watch me, don't try to do the breathing. But you're going to be timing, looking at the clock on the wall. We have clocks on both sides. When my contraction starts, like if it started at 11:01, you would keep that in mind. Then keep how many seconds it lasts from beginning to end, okay? Now you know when my contraction begins, because when it begins, I'm going to take a deep breath in through the nose and out through the mouth. And that's called a cleansing breath or a centering breath. So when I feel the contraction, that's what I do. And then I breathe in through the nose. Abdomen rises and out through the mouth. Slow, deep breath. Abdomen rises on the in-breath. Falls gently on the exhale. And I breathe at my own speed. When the contraction's gone, I take a deep cleansing breath at the end. So, can you give me the time that I'm going to write up here? When did it begin?
11:02.
You know, bidding for, I had one couple that was doing a great job. Probably not going to say that. Part, the peak, very quick, 10 or 15 minutes of rest. Phases. Cleansing breath at the end is important too, because it kind of lets go of the work. And the cleansing breath in the beginning is really changes your whole, you know, concentration and the feeling of your body, because you're just kind of welcoming the contraction and you're letting your body be soft and heavy all the way down to your toes with that cleansing breath. So coaches, when did it start?
11:12.
And how long did it last?
40 seconds.
You guys are masters. Now, what would the frequency of the contraction be? And when the contraction's over, the uterus relaxes. But over time, it doesn't quite return, to the original length. You're doing very well. Almost say you're 9 centimeters dilated. So it would be about 60 seconds. But whoa. So if you want to touch their head and say, come on, baby. So see the baby's head or touch the baby. Here comes the next contraction. Push. Now again, you can do breath holding or breath releasing. I'm going back to the breath holding. Push, push, push. Sometimes they count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Push again. 1, 2, 3. Okay, stop pushing. Pant, blow. Pant. Heads out. Woo! That feels.
Okay, so that's how antenatal class will be. Like it is like completely a lively kind of class. Okay, so with a lot of videos and pictures, they will you have to demonstrate them what will be happening and how it will be happening, so that they understand, they start practicing, and they do it during their labor. Is that clear? So it is not an easy thing, because during labor all they will have is pain. So during the pain also, if they want to do, then we need to give them a good practice, so that they end up in all these kind of all these breathing technique and practices, so that we will be able to help them to reduce their pain. Is that clear? So I'll send you the videos so you can have a look on it. If you have any doubt, then we can have a discussion in next class. Is that clear?
Yes, Miss.
So do anyone have any doubt?
For now,
No,
no.
Miss.
Okay. So if no doubts, then we can end the class. Thank you.
Thank you, Miss.
Thank you, Miss.